Hi, namaste. So today we will be discussing about case history. This is our fifth session. We already discussed about the four sessions. That is, the first session we discussed about introduction to psychology. Second session was about branches of psychology. Third was about goals of psychology. Fourth is about methods of study in psychology. And as I have mentioned in the fourth session, we'll be discussing about each method in detail. Okay. So today's topic will be case history. Under case history, we are discussing today only four headings because it is in detail we need to discuss, and it is a very vast thing to explain. So I'll be discussing only four headings in this video, and in the next video other few headings will be discussing. So first one is demographic details, second one is chief complaints, third is precipitating factors, fourth is history of chief complaints. Okay. Under demographic details, we will be discussing about, or we will be mentioning, the name of a person who is seeking for the treatment, then age and the gender of a person, then address and phone numbers. We need to collect more than 2 phone numbers. Okay, then education status, because education level and all we should know so that we can plan better based on their education for the therapy, and then their occupation. Then about the marital status, whether they are married or single, whether they are divorced or whether they are widow or widower, all those things has to be mentioned. And about the information, okay, about the informant, so who had informed about history, and whether the information is reliable or adequate, whether they have explained it properly, whether we think it is reliable or not reliable, so that we need to mention. Okay, then the second heading will be chief complaints. So under chief complaints, before going to in detail of a complaints, we should know the chief complaints, like for what reason they came for the treatment. Maybe most of the or many of the patients will come for treatment again and again. Maybe they will be having more than one episode. Okay, so this time they may be coming for a treatment for a third time. Okay, there may be two more episodes before also. So present episodes, so present complaints we should mention, so that is chief complaint. Regarding the past episodes and all, we'll be mentioning in other headings. Okay, under chief complaints, to know the clear picture about the patient, firstly we should know whether they come under psychotic or addiction, or it is a child case. We should differentiate if they are coming under the psychotic. So to know whether they are coming under the psychotic things, we should ask them about the questions about the delusions is mainly about suspiciousness, whether they suspect others are talking about them, whether they suspect somebody is laughing at them, somebody is planning against them, somebody had done black magic on them. So those are the delusions which I have explained. Even we have a separate videos for delusions. Then about the hallucination, you should ask whether they can hear a voice of a god, they can hear a voice of a dead person, they can see the images which a normal person cannot see. So hallucinations, regarding the hallucination we should question. Then we should ask about whether he talks to himself. Okay, when a person is a patient who is coming for the treatment, usually preferably the information is given by, case history is given by a informant, by a relative, by a wife, by a parents. Okay, wife or a husband. So you should ask them whether he talks to himself, whether he laughs at himself, whether he'll be laughing to himself. Okay, whether he'll be having a self muttering, making some lip movements, not making any he is not producing any voice, but he is making a lip movement. So self muttering is present or not. If these things are present, then you can think the case is under the psychotic condition. If we have to know whether the person is under the addiction condition, then you should ask about his habits, like alcohol consumption is there, or smoking of cigarettes, smoking of BD, smoking of ganja is there, or any other drugs he is addicted, or he is having a addiction towards a mobile. So you should ask about his habits. So habits are from how many days, like when he had consumed it, how much he consumes in a day. So all those details needs to be taken. Okay, if it is a child case, if a person who came for a treatment, whether it is a child, it is like maybe 5 years, 6 years old, or less than 10 or less than 15 years case, then you should ask mainly about their academic performance and the understanding level. So you should ask like what is the marks or how much he got, like he is a average student or above average or below average student. And then we should ask about the understanding level of a person, whether he can know the concept of numbers, whether he knows the concept of color concept is there, or money concept is there, or he can understand the instructions given by the parents or the teachers. That has to be asked. Then you should ask about the temper tantrums, whether the kid is not getting well adjusted with the other siblings, well adjusted with the students, or is not sitting at the school or disturbing everybody, irritating everybody. Okay, so beating or showing anger, aggression on the other siblings, or anger and aggression on the other students, that has to be asked. And then we need to ask about the childhood issues, like bedwetting is there, whether nail biting is there, or any other childhood issues are there, that need to be asked. And also about the adjustment skill of a kid, that need to be asked. Okay, if we get explanation of these things, then we'll come to know, we'll get some picture whether the case is psychotic, or whether the case is addiction, or whether the child came for seeking help for his studies, or seeking help for his adjustmental skills. Okay, after chief complaints you should mention precipitating factor. So precipitating factor is how it started, why it started, on what reason it started. Okay, so we should explain, or we should ask them about reasons for expression of those mentioned symptoms. The mentioned symptoms are started since when, after what incident, after what reason it started. Okay, so we should mention the triggering factors. For example, a case is feeling very depressed, dull, having crying spells, then we should ask why, since when it started. They may say that he got failed in PUC exam, after that he became very dull, he feels very inferior, doesn't mingle with the person, anybody, doesn't mingle with anybody. Okay, so the precipitating factor is failure in PUC exam. Then why it continued, like for what and all reason it continued. So for what reason he becomes very dull even nowadays. He becomes dull when somebody talks about his studies. He becomes depressed when somebody says about his exams. He becomes depressed when his siblings are going for a job interview. His siblings are going for a higher education. He feels depressed. Okay, somebody praises them, he feels depressed. So that is a triggering factor. So we should mention how it started, because of what reason it started, that is a precipitating factor, and because of what reason it is maintained, that is a triggering factors. Okay, next heading is history of chief complaints, where you will be explaining the chief complaints in detail. You have mentioned chief complaints in a points wise. Okay, it should be in a point. So chief complaint should be minimum only 5 to 6 chief complaints, and you should be in the point. In history of chief complaints, you will explain each point in paragraph. Okay, so for example, you have written self talk. So self talk means you should mention in history of chief complaints when it started. So in a day, how many times he speaks to himself, what and all things he speaks, like whether it is a normal conversation, or whether it is a using abusive words, whether he will be blaming somebody. So what it is, what he will be speaking. Okay, he speaks very loudly, or it is self muttering. How much time he speaks, once he starts, how much time he speaks, that and all has to be mentioned. So to be written in a different paragraph with the duration. Duration is since when it started. Okay, since 1 year, since 3 days, since 5 days he is having these complaints, that is a duration that has to be mentioned in history of chief complaints. So this is about demographic details. Then we discussed about chief complaints, then about the precipitating factor, and the fourth one we discussed about the history of chief complaints. So remaining headings in next video. So we'll be discussing other remaining headings in the next video. So for more interesting psychological topics, please subscribe to this channel very soon. Thank you so much.